Hello everyone, I'm Shannon. This is my presentation on basic wound care education. Before I go into my presentation, I am providing this purely for educational and informational purposes. Please seek medical attention if you are unsure how to care for a wound or there are any signs of infection. I hope you will find this video informative and that you will participate in a small questionnaire at the end. Hand washing is one of the most important ways to prevent infections when dealing with wound care. The CDC states washing your hands is easy and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community, from your home and workplace and hospitals. It is recommended to wash your hands before and after you care for a wound. Get your hands wet first using warm water. Apply soap. Ensure that you are using an antibacterial soap. Lather your hands by rubbing them together with the soap. Make sure when you're washing your hands that you are getting in between your fingers, under the nails, and washing the tops of your hands as well. Rub your hands together for at least 20 seconds. Rinse hands thoroughly. Make sure all of the soap is gone. Dry your hands either using a clean towel or air dry. If you cannot wash your hands or your hands are not visibly dirty, then you can apply a hand sanitizer to also protect against germs. Use any alcohol-based sanitizer with at least 60% alcohol in it. Make sure that you check the label to ensure the proper amount is in the product that you are using or looking at buying. One thing to note that if you are using hand sanitizer while you are out and about, once you apply it so many times, your hands might start feeling sticky. This indicates it is time to wash your hands with soap and water. Stop applying the hand sanitizer till you wash your hands, as it has become built up on your hands and is less effective against germs. It is important to note, and this is stated on the CDC website, that hand sanitizers do not eliminate all types of germs. To help protect and prevent wounds from forming, it is important to apply lotion or other moisturizers to the skin. Apply lotion or moisturizer after washing your hands to prevent from drying out and cracking. If cleaning a wound, apply lotion or moisturizer after cleaning and bandaging the wound. Never apply directly to the wound. It is also important to stay hydrated, as this helps the skin stay moist and prevent drying out and starting to crack. Recommended daily water intake for men is 124 ounces, women 92 ounces. Another preventative measure from having a wound created is keeping your home adequately lighted. Adequate lighting will help prevent you from running or bumping into things that can cause a bruise or tear to the skin. Make sure that areas around the bed and the path to the bathroom is clear, or furniture is out of the way and other objects is not blocking it. This will prevent you from bumping into or tripping over these objects and causing a wound or other injury to occur. An important thing to understand is that underlying health issues can cause wounds to heal slower. Health issues such as diabetes, cardiovascular disease, and obesity cause wounds to take longer to heal. People with diabetes, histories of stroke, limited mobility, or decreased sensitivity have a higher risk of having wounds like pressure ulcers. Always wash your hands before doing anything with the wound. With cuts, these can be minor and you may just need to wash the wound with soap and water and watch for signs of infection. If a cut is not bleeding, you can leave it uncovered. With scrapes, again, always wash your hands, then wash the scrape and dab dry. You can apply ointment such as Neosporin. Don't apply a lot, then place a clean bandage over it. Change the bandage often, and you can also reapply the Neosporin for a day or two. There may be a scab that forms. Once this occurs, do not reapply a bandage. Let it heal on its own. Also, do not pick at the scab. This will reopen the wound. And always check for signs and symptoms of infection. With bruises, if a bruise starts to swell and become hard, it is important to get this checked out immediately by your healthcare provider. Most bruises start to heal and fade within a week. If your bruise does not seem to be changing or fading in color within that time frame, you will want it to get checked out by a healthcare professional. Most bruises, the care is just watching for the things that I mentioned before and trying to prevent hitting or bumping that area, causing further issues. With tears, if the wound is bleeding, cover with a clean cloth, apply pressure, keep it elevated. This is to stop the bleeding if you can. Wash it with soap and water, rinse thoroughly. You don't want any soap staying in the wound. You can let it air dry, or you can pat it carefully and lightly with a clean towel till it is dry. Cover the wound with a non-stick bandage. You can get these bandages anywhere from Target, Walgreens, any of those places. Just read the label on the box or the container to ensure it is a non-stick type of bandage. You don't want to cause any further damage to the wound or skin around the wound with a bandage that is sticky that will cause further tears to the skin. Remove the bandage when you are bathing and after a day or so. If the bandage is visibly soiled, change it and watch it to ensure that it is not getting soaked through quickly. If it is, go to a healthcare provider immediately. It is always a good idea to seek medical attention if you cannot get a wound to stop bleeding. With lacerations, the same care for lacerations can be applied as a tear. Again, if you cannot control the bleeding by applying pressure, elevating the wound, or the wound is soaking through the bandage, go to a healthcare provider. With laceration wounds, if they are deep and you can see muscle or bone, this is also a good indication to seek medical attention. Another thing to keep in mind is after you have cleaned the wound and you can still see debris or dirt in there, it's also good to go to a medical professional. With lacerations, you can apply steri strips to assist the wound to heal back together. And you can get these at Target or CVS or Walgreens, as I mentioned before. With gashes, same care as lacerations. With both gashes and lacerations, you will need to remove the bandage after several days to ensure that proper healing occurs. You may want to apply the bandage during the day to prevent dirt or other things getting in there when moving around, but at night you can take the bandage off and let the wound breathe. It is important to always check your skin for tears, bruises, and wounds that appear on the feet, elbows, the buttocks, the groin areas, hips, and other areas where it is hard to see and there is moisture. I have on the slide frequent pressure ulcer locations to check for in the groin area, feet, heels, and toes, especially those with that have been diagnosed with diabetes, the buttocks area, and the sacrum. For skin tear locations, it's important to check the forearms, the elbows, legs, especially the shins and calf areas, and the abdomen. Surgical wound locations that you need to check for are the hips, knees, thighs, and spine. For wound care, again, wash your hands with soap and water for 20 seconds. Check for signs of infection, clean the wound, wash away any blood, dirt, and any other material. Apply pressure to stop any bleeding. Elevate the wound if you can to reduce swelling. Apply antibacterial ointment. Apply a bandage, wrap, or Band-Aid, or some sort of sterile dressing. Signs of infection are fever above 100.4 degrees, chills or overall feeling of unwell, green, yellowish, or cloudy and smelly drainage coming from the wound, redness around the wound site or red streaks spreading from the wound, skin that is hot or near the wound site, and an increased pain from the wound. If any of the above symptoms are present, please seek medical attention. Again, thank you all for viewing my video, and as I mentioned before, please fill out the quick questionnaire at the end of this video. The questionnaire is just to help me collect some data from all of you to complete my final project in school. And due to COVID-19 restrictions, I had to make my presentation virtual to keep all of us safe. The link is below in the video. The link is below in the video in the comment section. I appreciate it and hope you all have found this video informative and helpful.